you can't see a ligament on an x-ray. So then why are vets taking x-rays on these dogs? Well, some people would say it's because it's a money grab. What that really is good veterinary medicine. And here's why. When dogs tear their CCLs, even though ligaments are not visible on x-rays, lots of things that point to or suggest CCL tears are. So what people think is that these x-rays are unnecessary, and then they go off on this tangent like, I don't like that the dog is being sedated for the x-rays, but it's good to do that because a sedated x-ray can be positioned very well. Meaning the knee joint is supposed to be bent at 90 degrees and the ankle or hock is also supposed to be bent at 90 degrees. And sometimes you see these x-rays that are just poorly positioned. Sure, they can tell that there is no fracture, that there isn't a cancerous tumor, but if a surgeon was going to use planning software, which is specialized software that guides them before they even step 1 foot into the OR, as to how they'll do the TPLO cut or the TTA cut, where they'll position the implant, what size implant they'll use, what size screws and lengths they'll use, and measuring the TPA, which is the tibial plateau angle. The software is pretty robust. Sometimes when people get their x-rays done at a general practitioner's office, which is your regular family vet, and then go consult with a specialist, the specialist says, sorry, we need to take our own x-rays because these won't work for the software that we're going to upload them into. It's almost like if you're going to go to a consultation with a board-certified veterinary specialist, just let them do the x-rays because, trust me, they'll be better positioned. Let's think about this from a different angle, okay? I get the whole idea of why do x-rays when you can't even see the ligament, but as I was mentioning, lots of things that suggest the CCL is torn are visible on the x-ray. And so when the vets see those signs, then they can put it all together to make a diagnosis of a suspected CCL tear. So what are some of those things? Well, the first would be a medial buttress. And a medial buttress is some scar tissue that can form on the inner part of the dog's thigh. And usually this happens on dogs who have chronic CCL tears, which most of our dogs do. It's not usually due to an injury, an acute injury. It's due to a tear that happens slowly over time. There's joint effusion. Joint effusion is just a fancy way of saying there's fluid inside the joint because the joint is so irritated and inflamed. You can see this effusion behind the patellar tendon, which is the tendon that runs over the kneecap, the patella, and then inserts down on the tibia, the shin bone, the bone they cut with the TPLO or TTA or MMP or whatever surgery they're doing. The next would be bone spurs or osteophytes. Osteophytes happen when an area is unstable. The body recognizes this instability, and when I say instability, I mean the joint is just moving around too much. The ligaments are there to hold everything in place, to constrain the joint a little bit, so it's not all floppy. When the cranial cruciate ligament is torn, the femur slips back on the tibia. It slides down that steep tibial plateau angle. And then the body recognizes that and lays down new bone with these little tiny cells called osteoblasts. It's actually pretty cool. As those bone cells lay down, they create little spurs. It's the body's way of really trying to make an unstable area more stable again. The reality when it comes to osteoarthritis in our dogs is that most of them go in for their consultation already having arthritis. So when your vet says, I already see signs of osteoarthritis, don't be too surprised by that. That's kind of funny. Usually with a TPLO, the idea is that by stabilizing the joint and correcting the tibial plateau angle, making the joint be flatter, the top of the tibia, you're normalizing the biomechanics. I don't want to say that you're prohibiting or preventing future arthritis because they're going to have more anyway, whether you did surgery or not, but they'll have less osteoarthritis if you do the surgery than if you don't, and the dog is walking around with an unstable knee. The other thing they can see on these x-rays is the femur slipping backward toward the dog's tail. That's called caudal. A caudal slippage of the femur on the tibia, meaning the femur isn't positioned on the top of the tibia like it should be, and it actually can't because the CCL is torn. So we talked about joint effusion, and the slippage of the femur backward off the tibial plateau. Sometimes they have medial buttress, which is that scar tissue I was telling you about. The bone spurs don't just happen on the tibia and the femur, but they can happen at the bottom of the patella. There's a lot they can see. And in a normal knee, you don't see that stuff. When they all happen together, that's another way that your vet knows this knee probably has a torn CCL. And we don't even need to talk about the meniscus, because you also can't see a meniscus on an x-ray because it's made of cartilage. So you'd have to do a separate procedure, either arthroscopy or open arthrotomy. Dogs limp, not just because they have a torn CCL. I mean, sometimes they have an autoimmune disease. Sometimes they have Lyme disease from ticks. Sometimes they have cancerous tumors like osteosarcoma. As one of my vet friends says, you can't treat what you can't see. And so if you don't get an x-ray and you just go in there and do CCL surgery, is that really good veterinary medicine? I know a lot of vets who would say, no, it isn't. If your vet says, look, the history, everything that you're saying about the onset of how this injury happened, the way that the cranial drawer test feels when I test your dog's knee joint, the way they sit, the way they walk and change position, the swelling I feel in their knee, all of this points to a CCL tear. We can do a lateral suture or a TTA or a TPLO. We don't need to do x-rays. You can skip them. I'll tell you, knowing what I know now, would I go for that? I wouldn't, because I'd want to make sure they're checking off every box and making sure that my dog isn't limping because of some other underlying condition. Definitely worth thinking about, isn't it?